folks going here. Okay, online people, would you please pop a hello in the chat if you can hear us and see our slides? Perfect. Thank you so much. Our next speaker is Dr. Christina Moschetto. She is currently a resident in our Avian and Exotic Medicine Department with Dr. Andrew Bean. And she is going to take questions from your virtual audience at the end of her presentation. Feel free to pop anything into the chat as it occurs to you, but she will collect those at the end. And then to advance your slides, you can just tap here, or
Perfect.
once you get started, you can go over here too.
Okay.
Okay.
Perfect. Thank you. All right. Let's see. Good morning, everybody. Thank you for joining us today. And I know there's a lot of people online, so like Heidi said, I will answer all questions probably at the end of the presentation just for ease of things. But this is a presentation about the care and consideration of geriatric rabbits, so we will hop right in. That was actually not intentional, but I thank you for pointing that out. Rabbit pun unintended. Okay. So our objectives today are we are going to identify what senior life stages in rabbits actually are. We will discuss just preventative care basics and monitoring for our senior rabbits. We'll describe some common geriatric rabbit diseases and most importantly, their management, since a lot of these diseases can't be cured. And then we'll review some analgesic options as well to keep our rabbit friends comfortable. And finally, we will discuss very briefly some end-of-life considerations for when it is time to discuss that with our owners. So if you see rabbits in your practice, wherever you practice, you may notice that rabbits are becoming much more popular as household pets. Currently, rabbits are actually the third most common household pet mammal in both the US and the UK. And so both primary care practices and emergency practices are seeing them with more frequency. And now that we're learning more about them, managing their chronic conditions better, they are living longer. So we're seeing our rabbit pets age into this kind of geriatric stage where maybe we were not so used to seeing before. So with that comes, different challenges, especially with chronic conditions that can't be cured. Some breeds of rabbits seem to age more quickly or have a shorter lifespan in general. If you look at the books, the average domestic lifespan of a rabbit is about 9 to 12 years. But kind of similar to dogs, we feel like the giant breed rabbits, like continental giants or Flemish giants, have a shorter lifespan overall, where the tiny little dwarf breeds can be more equivalent to your Chihuahuas that may end up living longer. But for kind of general purposes, I consider a rabbit to be in the senior life stage when they reach around 7 years old and anything above that. So for basic preventative care, really important for our rabbit patients too, just like it is for our dog and cat patients. Generally, a yearly annual exam in their earlier life stages is appropriate, but as they age, I think that doing physical exams every 4 to 6 months is prudent, just so that we can keep a really close eye on their body condition, muscle condition, checking in with the owners about any mild problems that might be developing as they age. Likewise, a minimum database at least once a year with a CBC, chemistry, and urinalysis is a great idea for these guys to help us monitor for development of chronic kidney disease or other conditions that we might want to keep an eye on. And of course, you can do this more often if they're on specific medications or have conditions that you might want to watch a little more closely. I really like to recommend that owners do weekly weigh-ins. And this is super important, especially in multi-rabbit households, because it can be really hard for owners to really monitor how much is that one specific rabbit eating and pooping. Dogs and cats are often fed separately, and so it's easy to say, well, Sparky ate all of his bowl this morning, but he hasn't eaten all of his bowl, the past couple of days. Where rabbits are grazing continuously on hay and forage, and so it can be really hard to keep an eye on exactly how much each one is consuming. So the most reliable way is to actually weigh them, and just like they say for humans, weighing them at the same time of day, maybe pick a Saturday or a Thursday and use the same scale every time. And owners can keep a log of their pets' weights so that way they can start noticing, do we have trends of weight loss over a course of several weeks? That can be a red flag for maybe a subtle condition coming to a head. And then enrichment is going to be a huge deal for our rabbit patients. Just like all of our other animals, we want to keep them stimulated and alert as they age. And so enrichment can look like a lot of different things, and it can span from store-bought enrichment, like purchasing snuffle mats for them to forage around in, to eat their pellets, or you can get creative, old paper towel rolls, old toilet paper rolls, Amazon boxes. Rabbits love to chew, so you can repurpose your recycling and have them destroy it first before putting it out on the curb. Rotating fresh vegetables and also providing different varieties of grass hay can also keep them more interested in their food and just kind of give them a little buffet to play with as they eat. So that's our preventative side of things. So now we need to be looking at what are clinical signs of aging or pain in rabbits. What does that actually appear as? And depending on the underlying condition, obviously, it can vary. But some things we'd want to look for are altered social behavior or hierarchy. So again, especially in that multi-rabbit household setting, an owner might say, this rabbit used to be top dog, and now he's being bullied by the other rabbits in the home, which can kind of, maybe see a shift in that hierarchy with disease debilitating an animal. Decreased physical activity, just being less willing to jump on furniture, going up the stairs. Diet changes, so maybe not being so interested in a certain type of hay or certain type of food anymore can potentially indicate underlying disease. Possibly increased aggression or resistance to handling. So usually what that looks like is an owner will have a rabbit that's usually really cuddly and enjoys being pet, and they might say they don't want me to pick them up anymore. They are kicking me when I try to pick them up, and they just don't want to be bothered. Weight loss or muscle wasting, which a lot of owners, especially if they interact with their rabbits, will notice as they're petting them. They'll say, I'm noticing their spine is more prominent, their hips are more prominent. But if you have an owner or a rabbit that doesn't want to be touched, the fluffiness of rabbit fur can really conceal muscle wasting. And so that's part of that physical exam being really important to get your hands on them and reassess that condition every 6 months or so. Tooth grinding in rabbits is a generalized sign of pain. It's not necessarily dental pain specifically, but can be pain associated with anything. So if owners are suddenly reporting that their rabbits are just sitting there grinding their teeth, that can be a sign of, non-specific pain coming to a head. And so these are sort of our general signs. And now for the next several slides, we'll go into very common chronic medical conditions that we'll end up seeing in our geriatric rabbit population and how to manage them. I'm going to go through the diagnosis and the disease etiologies fairly quick because we don't have a lot of time, but focus mostly on our management of these conditions. So dental disease is a big one. Many of you probably know that rabbits have continuously growing teeth, also known as elodont dentition. So all of the teeth in their mouth grow throughout their lifetime. And they're supposed to be worn down by eating a diet high in fiber. And the origins of dental and periodontal disease in rabbits vary, but we think a big cause is a potentially inappropriate diet that is not allowing them to wear their teeth down correctly, potentially poor genetics, historical trauma that causes damage to the base of the tooth that's responsible for those teeth to continuously grow. And then, over time, just with age, they may have some breakdown of the periodontal ligament and be more prone to having teeth loosen up a little bit or having periodontal pockets develop. So clinical signs of dental disease can be pretty varied as well, but it can look like a selective or absent appetite. So that owner that says he's still eating his pellets and his fresh greens, but he really doesn't want to eat his hay anymore. That can be a red flag for dental disease. Drooling, dropping food, weight loss, poor grooming habits. And then in those rabbits that are unfortunate enough to actually develop dental abscesses, we can start seeing facial swelling or facial asymmetry as well. Diagnostically, there's a lot that goes into dental disease, but kind of the big three parts of dental disease diagnosis are going to be doing an awake oral exam on your 6-month preventative care exam for your patients, following up with imaging of some sort like skull radiographs or CT scan, and then an anesthetized intraoral exam to really do a comprehensive evaluation of those teeth, especially way back in the mouth that you're not going to be able to see on an awake exam. So on the left over here, this is an example of a rabbit that maybe you are seeing it. It's a 10-year-old rabbit, comes in for its 6-month preventative exam, and all of a sudden you look at its incisors, and it has this new incisor malocclusion. So this is a huge red flag because without a history of trauma, an animal developing a new malocclusion can tell us that he's holding his jaw inappropriately. He's potentially not chewing or grinding down his cheek teeth appropriately. That's causing this secondary clinical overgrowth. So once you see this could be a primary incisor problem, but this is your cue to make sure that you're using either an oral speculum or otoscope to look in their mouth and look at the cheek teeth to determine, do we have cheek teeth overgrowth, mucosal trauma from spurs that are developing on the teeth? So this is kind of fundamental part of your initial exam. So managing dental disease, again, complicated depending on what exactly is going on. But the biggest way that we encourage management of dental disease is to encourage animals to eat a high fiber grass diet. And going back to that enrichment, there are so many different types of grass hay that have different flavors, different consistencies. So providing them with a buffet of different grass hay can be really helpful to entice them to keep eating that fiber. And then daily oral analgesia is a big part of managing rabbits with dental disease because we're really probably not going to 100% cure dental disease, but the goal is to keep them comfortable enough with analgesia that they are still willing to eat that forage and fiber on their own and maintain at least somewhat of a normal dental occlusion. As needed, you can sedate or anesthetize your rabbit patients and file down those teeth. So, that rabbit with the incisor malocclusion would benefit from having those incisors trimmed so that it doesn't start causing mucosal trauma. And so doing that as needed just to keep them comfortable is sometimes indicated if they can't keep their teeth worn down appropriately on their own. And then if there is a dental abscess or, a tooth that needs to be extracted, surgical abscess debridement or dental extraction is indicated and can help kind of maintain that quality of life, with the big caveat that oftentimes, especially in older rabbits, these aren't isolated issues. And, there's a good chance that later on in their life, they may end up developing additional abscesses or potentially other issues that will need to be addressed. Oh, I think this is the Slido thing. Okay, here we go. Did I mess it up? Okay. So this is our interactive CE portion. So throwing you guys a little lob, you can hopefully get this one pretty easily, but which of the following clinical signs may be associated with dental disease in rabbits? There's no clock in here. I'm supposed to give you 15 seconds. Give you time, don't worry. Does that mean that there were 13 people that already answered up in the corner? Okay. Yeah. All right. I'll give 5 solid more long seconds and then we'll move on for participation. Okay. Oh, 15. All right. So great job, everybody. Drooling is a possible clinical sign associated with dental disease. So just keep that in mind if you ever have an owner that says, oh, it just seems like there's a lot of redness and stickiness on my rabbit's neck or on their chin. Have your suspicions high for potentially something dental related. All right. Okay, next topic that we'll talk about is osteoarthritis, another big one. And we see this in all kinds of animals, but in our rabbits, seems like the most common locations of osteoarthritis development are in the pelvic limbs and potentially the lumbosacral spinal region. And so just like our other animals, clinical signs can vary, definitely can be subclinical, but can look like limping, stiff walking gait, maybe reduced frequency of jumping on stairs or furniture. Binkying, for those that are not familiar with that term, a binky is a really cute behavior that a rabbit will do when they're excited, when they're running around, when they're happy. They'll sort of kick their legs up in the air, and you should look it up on YouTube. Highly recommend. But that's a sign of happiness and contentness in our rabbits. And sometimes owners will report that there is less binkying going on in their normal behavior. Maybe because there's musculoskeletal pain, it hurts them to do that natural behavior. And then some animals with osteoarthritis will also develop an unkempt kind of urogenital region or urinary and fecal accidents because it's harder for them to get in and out of the litter box or potentially to reach down and groom themselves. So just like our other animals, diagnosing osteoarthritis usually involves radiographs or sometimes just with palpation and range of motion on your physical exam. You may be able to palpate crepitus or stiffness. So again, that's another reason why doing those more frequent exams in the geriatric life stage is going to be really helpful for catching these things. So there isn't a lot of research out there about naturally occurring osteoarthritis in rabbits, but for the one of the best papers that we have out there had these couple of reference photos. So you can see sort of these osteophytes developing within the stifle joint as well as the hip joint of a rabbit with different stages of arthritis. So these are examples of some of the things that you might end up seeing develop on your radiographs. So management of this condition, daily oral analgesia, again, is going to be really important for maintaining comfort, maintaining a lean body weight. So we're taking excess weight off of those joints that are already under extra stress, encouraging light exercise a couple of times a day. And that goes back to your enrichment. You know, the best way to get a rabbit to exercise is usually to entice them with their favorite food or treat. So making them work for that a little bit can really help them move around. Environmental modification for those animals that need a little extra help. And I'll show you some images of what that look like, but a lot of times your standard pet ramps or pet stairs can be really helpful, and then switching to low-sided litter boxes. And then for those rabbits that are having trouble grooming themselves, periodically either having the owner or bringing the animal to the veterinarian to do a sanitary shave and assisted grooming, just kind of trimming that fur to prevent matting and secondary urine scald can be really important to keeping them comfortable. So over here, You know, a young spry rabbit usually has no issue jumping from the floor to the couch and sometimes even higher. But this guy needed a little help, so using ramps with good traction can really help them. Low-sided litter boxes, just like they sell for cats, work as great alternatives. And then I don't know if you've ever tried to bathe a rabbit before, but it's not really fun if they're awake and they're fighting you, and it can be really stressful. And so, short of doing that, what I like to tell owners to do is keep unscented baby wipes on hand. Even just doing unscented baby wipes once or twice a day in the urogenital region can help kind of clean up some of that extra debris, and it's less stressful on everybody in the home, including the rabbit, than submerging them in a bath of water. Additional management for osteoarthritis, and I have a little asterisk here because we have very limited peer-reviewed evidence about any of these methods, but nonetheless, they're still very important. So we are familiar with a lot of these multimodal management practices with osteoarthritis in dogs, cats, horses, and so there definitely could be a place for them in our rabbit management as well. Acupuncture, laser therapy, also known as photobiomodulation. Both of those can be really helpful in reducing inflammation at the site of specific joints that are agitated. Glucosamine chondroitin supplements. So actually up here in the corner, Oxbow, which is a common small exotic animal nutrition company, they do make these joint support supplements that contain glucosamine, and they're these little wafers that are really palatable, and they usually take them just like treats. So we don't know exactly how much of a difference these make, but they're unlikely to hurt, and it's an easy thing that owners can do at home to feel like they're doing everything for their aging animal. Likewise, omega-3 fatty acids. You can find some plant-based omega-3 fatty acid supplements that may be more palatable to a rabbit than the fish oil-based, since our rabbits are strictly herbivores, but that's something that you can add in. I have heard of individuals that have experimented with Adequan injections, so the polysulfated glycosaminoglycan injections that are marketed for horses and dogs, given on a subcutaneous basis. Again, no evidence that it is effective in rabbits, but some people will use those in their exotic animals as an adjunct therapy. And then another thing that is really easy for owners to do at home to feel like they're doing the most. If you're familiar with the Assisi loop or targeted pulse electromagnetic field therapy, they come in the form of the loops. They come in the form of little beds that are supposed to emit the pulse electromagnetic field. Some owners will purchase those, and then they can do them at home for their rabbit on a daily basis. And that may be a little bit less stressful than having them come into the clinic frequently for these other therapies. So real quick, we have on the left here a very responsible rabbit wearing his eye protection while receiving a laser therapy treatment on his hocks. And then on the right over here, a rabbit that's actually receiving acupuncture therapy. And obviously, these are very patient-specific treatments. It takes a very special, relaxed rabbit to be willing to do this. But if you have the right candidate, power to you. Kind of related to osteoarthritis is pododermatitis, also known as sore hocks or bumblefoot. So this can be a sequela to osteoarthritis when an animal is not moving around as much as they used to. They can start developing these pressure sores. Oftentimes they start just at the point of the hocks, but can progress to the entire foot, as well as sometimes we'll see this develop on the front feet too. And so aside from osteoarthritis, sometimes being housed on an inappropriate substrate, so rabbits that are housed on strictly metal graded floors with no solid floor to rest on can be predisposed to this, as well as animals that maybe have had amputations performed earlier on in their life. They're offloading weight, or maybe they had an injury where they're chronically offloading weight on some of their limbs, and those limbs are going to be more predisposed to developing pododermatitis. And so a lot of times this is subclinical, so looking under their feet during their physical exams is going to be really important. But when it gets very bad, you may start seeing, bleeding or scabbing of the feet, as well as overgrooming and limping clinical signs. Management is going to be pretty similar to our osteoarthritis management. So having that lean body weight, encouraging light exercise, and then environmental modification with additional padding is really important. So people can buy yoga mats and layer them up. Also, these sort of interlocking foam tiles that you can find for gyms, those can be really helpful too. Or even just layering, extra layers of blankets or carpets can be really helpful, especially, for a lot of people, their rabbits are free roam around the house. So they're like, I can't put yoga mats all over my house. But even just padding those extra areas, maybe around where your rabbit tends to sleep or where they're eating or spending the most time, can provide them with a little extra reprieve. In addition, we have some sort of bandaging and direct foot options. So obviously, if there are open wounds or sores, you may need to treat with antibiotic therapy and even, do a little modified Robert Jones hock bandage for them periodically to keep those clean and protected. But Etsy is amazing, and there are actually people that will sew these custom hawk socks. And I have a couple of clients that have used these and basically have trained their rabbits to tolerate wearing them. They don't necessarily wear them all the time, but they wear them when the owner's home and when they're active running around the house. And there's these little Velcro wraps that owners are able to put on and take off by themselves. And this is an example of a bunny just doing his daily romp around the room wearing his hawk socks. So this can be helpful for kind of management and prevention of sores developing, especially if you know that you have a patient that's already predisposed to them. All right, dacryocystitis. This is another common one that we'll see in older rabbits that is characterized by inflammation or obstruction of the tear ducts. And the etiology for these can be very wide, but sometimes they are primary chronic infections. Sometimes they're related to dental disease or rhinitis. But the clinical signs often localized to mucoid to clear ocular discharge. So you can see this rabbit, nose is on this end, ears are back here, and there's this chunky mucoid discharge coming from the nasolacrimal punctum. They can sometimes have swollen eyelids, matted periocular fur, and secondary moist dermatitis as well. So this guy on the right, again, nose is over here, ears are back here, and you can see that his fur is just looking really unkempt around his eye, and he's got some erythema in the medial canthus. So diagnosing dacryocystitis does involve, looking for the underlying clinical condition, but doing a nasolacrimal duct flush can be helpful just to see, do you have patency by cannulating that nasolacrimal punctum and flushing saline through the nasolacrimal duct. You should be getting mucus or even saline coming out of the nose at the output point on the ipsilateral side if you have a patent nasolacrimal duct. You can also perform a dacryocystogram, also known as a just contrast image, where you're, instead of flushing saline, you're flushing contrast into the nasolacrimal duct. And so this is an image of a radiograph taken after contrast was flushed in the duct, and the white arrows kind of delineate the path of our nasolacrimal punctum. I always think it's prudent to make sure we don't ignore other possible eye conditions. So if you have a rabbit that comes in with blepharitis or a lot of mucoid discharge, don't forget to fluorescein stain. Don't forget to perform a tonometry just to make sure that we don't have a concurrent maybe corneal ulcer or potentially glaucoma that could be contributing to those ocular signs. So managing this condition, This is a frustrating condition to treat because a lot of times it cannot be cured. Even if the underlying inciting cause can be treated, the nasolacrimal duct is very thin. It's prone to fibrosis or stricture developing. So a lot of times these rabbits will have chronic tear overflow either intermittently or consistently for the rest of their life. For those primary conditions, especially if we're thinking there's a bacterial condition, using antibiotic eye drops can help control local bacterial or conjunctival infection. And then sometimes just periodically flushing the nasolacrimal duct can be really helpful for providing relief. So I have a handful of patients that maybe come in every 3 months or so for their maintenance flushing, just kind of like an oil change, to clear out any debris that is in that nasolacrimal duct and just give them a fresh start. And owners will call sometimes and say, oh, there's a lot more discharge. I'd like to come in for sort of a refresher flush here and there. NSAID ophthalmic drops versus steroid ophthalmic drops have been used by various people. I've experimented with both of them. The consensus is that one is not necessarily better than the other for controlling nasolacrimal duct inflammation at this time. But it is something that you can use as an adjunct, especially if your patient has a lot of conjunctivitis and blepharitis associated with whatever is going on. It can just help provide a little bit more local control. And then if this is a upper respiratory condition or rhinitis condition that is migrating into the nasolacrimal ducts, nebulizing with either sterile saline or sometimes medicated nebulizer solution can also be helpful. The biggest component of management is always going to be fur control, in my opinion. So dacryocystitis or a blocked nasolacrimal duct itself is not necessarily painful, but what is really painful to these animals is the tear overflow and the secondary skin infections that they get. So this is the same rabbit that was on the screen a few slides ago with all of that matted fur on his face. And so this is what it looked like after we just shaved that fur. You can see that he's really erythematous, kind of ulcerated skin, and it was a bilateral condition as well. So keeping them shaved more frequently and keeping that fur trimmed short can prevent the matting from developing. We're not necessarily going to prevent the tear overflow, but we can prevent the matting from developing. So maintenance shaving of the periocular area, maybe when they come in for their periodic nasolacrimal duct flush, you can also give a cleanup shave. And then this is a trick that our dermatologist here, Dr. Meyer, taught us. So using a salicylic acid-based ear cleanser, not medicated, but just salicylic acid-based, the type of ear cleanser that you would use after your dog goes for a swim. The salicylic acid can really help dry out the skin. And so we don't want to get this in the eye, but especially for these animals that have really severe kind of medial canthus and surrounding eye skin irritation, having owners put some of this on a little cotton pad and just dabbing that irritated skin can help dry it up. And then you can follow that with either a diluted betadine solution for antiseptic cleansing and silver sulfadiazine cream. The nice thing about diluted betadine solution and SSD cream is that it is safe if both of them get in the eye. The diluted betadine solution is actually, what we'll use for ocular surgeries or periocular surgeries. So we want to keep the salicylic acid really just for the periocular skin, but for eyelid lesions or direct, direct contact with the eye, the silver sulfadiazine cream acts as a really nice skin barrier. I'll usually have owners apply this, once or twice a day, whatever their animal is amenable to. Oop. All right, another interactive situation here. So thinking back to our other slides, which of the following is not an effective method for managing pododermatitis in rabbits? The goal is to get participation, not to trick you guys. Exactly. I think we had 15 people answer last time, so it looks like everybody has participated. Absolutely. We don't want to have our pododermatitis animals gain weight. We want to keep them nice and lean so that we're not putting excessive weight on their feet and predisposing them to developing worsening sores. Great job. Okay. Vision loss and cataracts are ones that we see fairly often in older rabbits. And cataracts, like other animals, can develop related to just age-related lens degeneration. Maybe a history of ocular trauma can predispose them to vision loss. And then the unique thing that we see in rabbits is that a history of an E. caniculi infection can cause E. caniculi-induced uveitis. And it creates these really pathognomonic lesions that can predispose them to cataract development. So this guy on the left kind of has that mature looking cataract, blue, opaque, and that's pretty typical of just more of an age-related lens degeneration. But this guy on the right, you'll notice looks a little different. You kind of see this kind of irregular anterior chamber mass effect. And this is a very classic E. caniculi induced uveitis lesion where the lens actually becomes inflamed and breaks down. And so a lot of times these animals will end up with chronic granulomas in their anterior chamber for the remainder of their life, which, as long as we control the inflammation, doesn't necessarily cause harm, but as they age can be a predisposing factor to progressive cataract loss and vision loss. So you will be doing your fundic exams on your rabbits just like you would in your cats and dogs, maybe testing tonometry to make sure that these cataracts are not causing secondary glaucoma or uveitis. And then if you suspect that you may have a rabbit with active E. caniculi infection, you may consider doing E. caniculi titers. But that's kind of our two big forms of cataract or ocular disease presentation in our older rabbits that we tend to see. So managing these guys, a lot of times rabbits with cataracts or those chronic anterior granulomas are subclinical. They live their lives without any issue. You can periodically be rechecking their tonometry just to make sure that we're not developing glaucoma as that cataract kind of progresses and matures. And then obviously if we do have secondary complications like glaucoma or uveitis, you would want to medically manage them with either topical eye drops or with an ophthalmologist. And truly, if those become unmanageable with topical medication, you can do a salvage enucleation just to keep them comfortable. But a lot of times it just sort of involves managing their environmental situation. So providing food and water in multiple locations. Maybe it's harder for them to find their food and water. So making sure that it's easy and accessible for them. And then avoid moving cage furniture, litter boxes too often. Try not to confuse them because they will learn their environment using their whiskers and their sense of hearing and just, their sense of smell. And then kind of an inadvertent thing that happens, especially in multi-rabbit households, is seeing eye rabbit phenomenon. So a lot of times, the blind rabbit will sort of latch on to a buddy rabbit where they will stay really close to them, and then the visual rabbit will help guide them around their environment. So we have a couple of blind rabbits that come in, and when they come to the clinic, they are so disoriented. They don't know where they are. It seems like they have trouble walking around, but the owners say, at home, they're just running laps. They know where everything is. They have a great quality of life. Their cage mate helps them navigate. So it can be, they a lot of times transition into that sort of blind era of their life without much difficulty at all, which is really nice. All right, chronic kidney disease. So this is a big one. And again, the predisposing factors etiology are many, but it can be related to just age-related GFR loss. Sometimes we can have acute on chronic conditions where we have an acute kidney injury, either caused by an infectious disease, an ischemic event, or even a nephrolith or ureterolith developing. But the clinical signs as well mimic many of our other species that can be subclinical. It can look like abdominal pain or belly pressing, urinary accidents. And then another thing to watch for with rabbits is they will start developing sometimes urinary accidents that lead to fecal and urinary matting, and sometimes urine scald of the surrounding area. So diagnostically, you'd be doing a lot of the same diagnostics you'd be looking for in dogs and cats. So checking your biochemistry panel, urinalysis. In rabbits, E. caniculi can manifest as a kind of acute nephritis syndrome. So if you're suspecting E. caniculi, maybe considering your titers. And then you can potentially take radiographs or have an abdominal ultrasound performed to help diagnose structural changes. So this is just an example of a rabbit with really severe bilateral nephroliths, as well as small ureteroliths. Managing these guys, we're gonna watch their renal values and their USG very closely. We want to stay away from NSAIDs, just like our other species. So no meloxicam for chronic kidney disease rabbits. You can increase oral water intake by placing more than one source of water around the cage. And then if you're familiar with critical care, which is the powdered syringe feeding supplement, a lot of rabbits find that really palatable. And so you can actually mix up a really soupy diluted critical care, and owners can syringe feed that once or twice a day for extra oral water intake. And then subcutaneous fluid therapy as indicated if your patient will tolerate. Other forms of management for our rabbits, so providing a lower calcium diet has been advocated, especially if you have rabbits that are already dealing with nephroliths or ureteroliths or even sludge in the bladder. Rabbits excrete all of their excess calcium through their kidneys and into their urine, so they're more predisposed to potentially developing these calcium-based stones. So possibly removing those high sources of calcium like kale and spinach and all of those dark leafy greens from their diet can really help reduce the general excretion and contribution to that crystalline debris. Providing additional litter boxes for them, urogenital shaving, again, butt baths or unscented baby wipes to just help clean that area as needed if they're having accidents. And then just like our joint supplements, Oxbow does make these urinary tract supplements that are marketed to small exotic animals. I believe they have, cranberry extract in them. And again, do we know if they work? Not really, but they're probably unlikely to harm, and they're usually accepted really well by these patients because they're like treats. All right, real quick. You're seeing a rabbit at your clinic and it's painful for some reason, so you're going to prescribe an analgesic. What is the first analgesic that you tend to reach for in rabbits at your clinic? This one takes a little more thinking. All right. As expected, I'm seeing a lot of meloxicam or Metacam. Some gabapentin seems to be more common as well. And then we have a couple people that will use buprenorphine or high-dose coxib as well, which is interesting. Oh, I was like, is that you? That was Andrew Bean. Please ignore him. All right. So meloxicam is definitely one of the most common analgesics that we'll end up using for rabbits. I think the really important thing is that we need to be dosing it appropriately. So the biggest issue that we have is rabbits that come into the clinic on very low doses of meloxicam, like 0.2 or 0.3 mg per kg. And we have PK studies that indicate that they very likely need much higher doses, more like 1 mg per kg, to actually provide analgesic effects. But meloxicam is a great drug, it's palatable, and it does not have drowsy side effects for most patients. As adjunct or multimodal analgesia, we can also add in gabapentin. Sometimes we can add in tramadol on top of gabapentin as well. These drugs do have a little bit of a risk of drowsiness, so it's something you want to talk to your owners about ahead of time. But, a lot of times for these chronic conditions that get worse over time, just meloxicam is not enough. And so we add in our multimodal forms of control. And then I added in pregabalin here just to kind of fill you guys in. Pregabalin is a anticonvulsant medication similar to gabapentin, but it is something that we have used for some patients that have been refractory to other analgesia. A lot of times we'll end up using it in rabbits with IVDD or neuropathic spinal pain. There's really no analgesic studies on this in rabbits. So with the guidance of our neurologist, we've dosed empirically at dog and cat doses. And there is a liquid form of gabapentin, which is nice. You don't have to compound it, but just something extra to have in your arsenal that is fairly available in vet med at this time. Okay, and then finally, end of life considerations. So ultimately, no matter what we do with our pain control, these conditions will probably end up progressing. And so the question is, what is a good quality of life at the end of a geriatric rabbit's life? And a lot of that is to be determined in conjunction with your owners, but what can help is, again, if they're seeing that steady weight decline over several weeks, that can be a clue in for them. I like to refer owners to the Ohio State Quality of Life Scale. And towards the end of a chronic condition, doing weekly assessments of quality of life as well can be really helpful for owners that, you're emotional. It's hard to make those assessments, but having these objective numbers and tracking them can really help them see if their patient's quality of life is declining. And we also recommend that every member of the household fills out their own scale, because the person that's out of the house 12 hours a day working may have a very different perception of that animal's quality of life than the person that works from home and is with them seeing all of their behaviors during the daytime. So doing this as a family ahead of time can be a great way to get all family members on board with, what are our goals, what are our benchmarks, what is our cutoff number for an appropriate quality of life. Okay, that is all I have for today. I know that was very quick, but I'm gonna check on the chat, see if we have any questions in here, and then I will turn it to the room here and see if we have any other questions. Let's see. Okay. So someone in the chat said, our hospital doesn't see many rabbits. However, I would like to change this. Any resources, continuing education, websites, so we can get the support staff prepared for husbandry, enrichment tips, or obtaining blood work and radiographs. Yes, that's a great question. Thankfully, we do have more resources available. If you can join the Association of Exotic Mammal Veterinarians, they have really great client education sheets and resources for veterinarians treating rabbits and other small mammals. In addition, Lefeber Vet is a free resource that is available for veterinarians. I guess I can put that in the chat here so you know the spelling of that, but Lafeber vet.com is going to be a really great resource for people that are really starting to learn about rabbit medicine, as well as they have some nice client resources too.
You got credited for checking that.
Thank you. Dr. Bean just also contributed that the AEMV, Association of Exotic Mammal Vets, has monthly rounds, and you can get CE credits as veterinarians for attending them too. So that's another bonus.
I may be misspeaking.
He said it might be quarterly, but they are CE accredited rounds, so you can explore that a little bit more. Okay. Someone had asked, how often do you recommend cleaning at first? Any chance of overdoing and irritating the area? I'm assuming this is probably in relation to cleaning the periocular area. And so generally, I would say for the first few days, just using the salicylic acid cleanser once a day. You can put on that SSD cream as often as you want because it's a skin protectant. I guess I haven't seen any adverse effects because that area is so irritated to begin with. There's always, I guess, a chance of them having an adverse reaction to the salicylic acid cleanser, but so far I haven't seen any issues with that frequency. And then as we dry out that infection, we can kind of spread out the frequency, like maybe cleaning every 2 to 3 days or like every 3 to 5 days for maintenance, drying, and cleaning moving forward. Good question. All right, great. Those are all the questions I had in the chat here. Does anybody in the room have questions? Sure.
For the incisor trimming,
Mhm.
you need a special tool or can you use a regular dental drill for that?
Good question. So for those online, the question was for incisor trimming, do you need a special tool or can you use a regular dental drill? You can use a regular dental drill. We'll usually end up using a dental drill with a high-speed handle and a cutting burr to kind of cut the bulk of the incisor off, and then you can use a diamond burr to sort of smooth the edges. I think the photo that I had here, some people may be familiar with, they sell these diamond disc attachments as well that you can actually attach to your dental drill. So it's like a spinning diamond disc that you can kind of just go zzz and cut right through the incisor that way. But you can totally use your standard dental drill. What you don't want to do is take like dog nail trimmers or anything or clip the teeth because that blunt cutting can actually crush and split the teeth higher below the gum line. So always using, your Dremel or your dental drill is going to be priority number one. Good question. Dr. Bean asked, how do you protect the soft tissues if you're using the high-speed drill? So great question. We'll usually just take like a tongue depressor and put it behind the incisors. So that way, as you're cutting through the incisors, it's going to hit the tongue depressor first before touching, the tongue or the lips behind it. Yeah.
For OA and rabbits, is that something that is common, just geriatric rabbits, or is it more associated with rabbits that were obese or had other, like an amputation?
Great question. The question was for osteoarthritis in rabbits, is that more commonly associated with just aging changes or more so related to previous amputations or injuries or obesity? And the real answer is we don't actually know. There isn't great retrospective data on sort of risk factors for OA development in rabbits. But I feel like for our geriatric population, even the ones that have not had previous injuries or amputations, as they age, we still will see them develop osteoarthritis changes. And I don't know if that has to do with just the shape of their spine and the way that they sit kind of hunched naturally, and that's sort of predisposing them to develop in those pelvic limbs and lower spine. But we see it even in the ones without prior complications. Yeah, absolutely.
Thank photodermatitis or a bad skin infection around the eye, do you use convenient rabbits or is that a no?
Great question. So the question was, can you use convenient injections in rabbits for, you know, those secondary skin infections where you want some antibiotic coverage? So the big classes of drugs that we know to be strictly harmful to the rabbit GI tract are usually the oral administration of drugs. You can administer, you know, IV Unison, IV cefazolin, subcutaneous cephalosporins to them. That being said, we don't have a lot of information about convenient in rabbits. So any antibiotic in a rabbit, even antibiotics administered parenterally, theoretically can throw off their GI flora. So if you could use a drug that is considered more appropriate for them, but if you are going to give a convenient injection, what we want to make sure is if you're giving it subcutaneously that we're not having any leakage, because then if they do lick that off of themselves, that could absolutely like send them into a dysbiosis. But at this point in our research, we don't know why some drugs given orally or parenterally cause massive dysbiosis and some don't when they're theoretically still killing the same spectrum of bacteria. So if you have other options, I would reach for those first if it's feasible, and always warn owners about, you know, the risks of what to look out for in terms of dysbiosis, diarrhea, going off of feed, abdominal pain and bloating, that sort of thing. Good question. Okay. Anybody else have questions? Andrew?
This is a real question.
Okay.
Out of control question. What is your experience when you send home oral tramadol for rabbits? What do your clients tell you about how well the rabbit takes it?
So the question was, in your experience when you send home oral tramadol for rabbits, what do your clients tell you about how well they take it? Hit or miss. I feel like some rabbits are a lot pickier and they just really don't like the taste of gabapentin or tramadol, and some people don't report any issues. For any liquid medication that we feel a rabbit is not tolerating the flavor of it for some reason, you can always tell owners to mix up a little bit of critical care right before and mix it with that medication to mask the flavor. Basically, like, you know, adding flavor drops to the chalky tramadol medication. But yeah, I feel like some of them tolerate it okay and some of them don't.
I've had a few, just in the past few weeks where they, I mean, tramadol tastes terrible, period, but like the owners have quite a bit of difficulty giving tramadol, so I just told them to stop.
Just stop it. Okay. Yeah. He was just saying that he's had a few patients recently that have been extremely resistant to the flavor of liquid tramadol. So at that point, if it's causing more stress and debilitating their quality of life, just stop. Okay. All right. Well, I have definitely run over my time. I apologize for that, but thank you for all of your great questions and participation. And our next speaker will be up soon. Thank you, everybody.
All right, thank you so much. That was great. Okay, we're going to take a little break and we'll get started again at 10:30. Thank you.